syndrome is actually quite a complex ocular disease, but could be thought of simply as a lack of tears to lubricate and nourish the eye surface. And primarily we're talking about the cornea, which is the front clear window of the eye, which has to have a constant layer of tears to give you good vision and be comfortable. We can think of dry eye syndrome as basically coming in two main flavors, one being a lack of the water production part of the tears, and the second being a lack of the oil production of the tears. The symptoms of dry eye syndrome are actually quite diverse. Some people actually have the feeling that their eyes are dry, that they just need to have something on their eye surface. Other people feel like their eyes are just irritated, they're stinging and burning, sometimes as it gets worse throughout the day. Other people feel like they just want to rest their eyes closed because they feel tired. And lastly, some people can actually have excessive tearing even though their eyes are dry. And although this seems like it doesn't make a whole lot of sense, if the eyes aren't making a constant level of tears throughout the day, sometimes they'll react by having a whole bunch of tears form at one time. And that's how we can have tearing even though our eyes are dry.
Common causes of dry eye include normal aging, side effects of numerous medications, general health conditions, eye injuries or surgeries, hormonal changes, smoking, sun exposure, excessive computer use or gaming, and contact lens wear.
Dry eye is on the rise. Unfortunately, we're seeing this in our practice, and we're actually seeing this worldwide in study. I know patients suffer a lot from dry eye because I hear them coming in and they have like literally a bag full of eye drops that they're constantly putting in their eyes. None of these things seem to be working for the patients we see. Luckily for us, a new procedure has come out called LipiFlow. LipiFlow is the only FDA-approved dry eye treatment on the market today. LipiFlow uses a special device that we just gently insert onto the eye. Your eyelids drape over a warming device that warms up your glands, and then a special instrument sits on top of a little air bladder to massage the eyelids and secrete all those hard oils that have been sitting there for years and years and years. So I personally suffer from dry eye. I've had LipiFlow performed on myself. I couldn't believe how much better my eyes have felt, literally from day one.
We usually use lubricating eye drops, which are over the counter, a form of artificial tears. Often we suggest preservative-free eye drops for people. We can also use an over-the-counter lubricating eye ointment for such problems, and occasionally we will also recommend warm compresses to deal with the inflammation.